You almost got it right.
Saemundur.
So my name is Saemundur Oddsson, and as Emma mentioned, I'm one of the co-founders of SidekickHealth. We are a company that have benefited greatly from being part of the Saemundur Science Park, and I'm honored to be here today and present our story in the next few minutes. As the name or as the title indicates, we have gone global. We are a company with rapidly growing revenues. We have customers in many continents, and we have established a strong foothold within vertical in US healthcare, like I will explain. But it seems as if this one is not working, but they will be fine. So I would say our story so far is built upon these three chapters. First, you need to define the problem, then assemble a world-class team, and then be creative when it comes to business development. And actually, we are now in the middle of chapter 4, where we are scaling up sales and marketing and raising more venture capital to speed up the process. So my background is that I am a medical doctor, and as you know, there is a tsunami of lifestyle-related diseases upon us, such as type 2 diabetes, that stand for 80% of healthcare costs. The main root of these problems is bad diet, physical inactivity, and stress. And also when it comes to secondary prevention, these lifestyle factors weigh very heavily. And I learned from helping patients at Saemundur across the street that lifestyle change is both difficult and expensive if we use traditional methods. And simultaneously, during my training, the smartphone technology changed the world from this to this. And this opened up a new era in preventive medicine with never foreseen opportunities to engage patients. So what we did, my co-founder and I, we gathered a world-class team. So today we are over 24 professionals, both on the behavioral and medical side, but we're a complementary team of individuals from the gaming and tech side. And so what we have created is the new prescription for lifestyle change support as a part of chronic disease management. And I would say the secret behind our success is that on the surface, it looks like a game where the patients and users get points and rewards for tackling bad diet, physical inactivity, and stress. The cornerstones in managing chronic diseases, such as type 2 diabetes. And then, along with the product, we have an admin portal that's interoperable with systems. We have won a lot of grants and rewards. And the reason why we chose this gamified route is that research has shown that our health behavior is primarily governed by two distinct systems in the brain. So we have the emotional system, which takes care of primitive things like security, food, and everything that's social. And then we have the more developed parts of the brain, and the cerebral cortex, that are great when it comes to analyzing data, but not nearly as rewarding. So the eye-opener for me was to see that those that have been successful in changing people's behavior, they have been talking to the emotional system. But how was I trained as a physician to address this? I was trained to deliver facts and figures and statistics, and then we can ask ourselves who is winning. Now, I remember clearly when this struck me. I was sitting across the street at Saemundur, and I had a patient with type 2 diabetes. And I was using the traditional methods. I was telling the patient, if you don't give up smoking and eat healthier and start exercising, you will increase the likelihood of a heart attack by X% within 10 years. And the patient just nodded his head. But 15 minutes later, I looked outside the window, and I saw that same patient lighting a cigarette, holding a kanelbulle. So we see that the current approach is simply not working. And actually, the current approach only helps a fraction of the population. It helps those that are already motivated, like this guy in the yellow shirt. So we created Sidekick to target those that have low health literacy and low health motivation. So that's what we're all about. We quickly realized that we had to be creative in terms of business development. And nobody said that getting a digital health company off the ground was easy. And this picture could be from a Saemundur Science Park during long working sessions. And it reminds me of how valuable it is to have access to world-class advisors, such as our friends at the Saemundur Science Park. And so if I were to share our story, one take-home message is it's better to start narrow and go deep instead of going broad and shallow, which is also called spraying and praying. So one of the market opportunities that we have found is that we service providers of diabetes prevention programs in a B2B software as a service model. And I mentioned in the beginning that there is a tsunami upon us in terms of lifestyle-related diseases. I was not exaggerating. There's data out there that indicates that 1 in 3 Americans have prediabetes. So there's a lot of awareness in this space right now, and it's become a reimbursable benefit. So the health insurers are now paying for diabetes prevention programs. So this field is growing very rapidly. And we, in particular, like the US-based DPP program because it's proven to reduce your risk by 60% of developing type 2 diabetes. So the problems that are facing our customers, which are the providers in the US, is that they are having a hard time extracting these value-based reimbursements from the health insurers. And the reason why is that they're tied to milestones. And it's actually quite simple. So if your patient drops out, you stop getting paid. And if your patient reaches 5% weight loss, you hit a significant revenue milestone. So we identified this and we executed a randomized controlled trial in collaboration with our colleagues at Harvard, showing that if you add our product, your patients are 3 times more likely to reach 5% weight loss, and attendance significantly increases. And that leads to a 60% ROI when rolling out our product. And this has not gone unnoticed, these results. And one other lesson learned is that the earlier you can employ professional marketing people, the better. And luckily, we were able to headhunt these individuals, and we launched thought leadership and content marketing campaigns. And we do a lot of trade shows. And our story has been picked up in industry-leading journals and magazines, mostly in the US, but also internationally, as you can see here. And this is very important when it comes to market access, because inbound leads from health systems, that's what we are working on right now. So that has led to our strong foothold within this vertical. It's narrow, but it's actually very deep. So we're working with the largest provider of DPP in the US. We have partnered with the best-known brand in this space called the AADE, American Association of Diabetes Educators. And we have customers, and amongst the customers are health systems that serve much more than 10 million people. So on a lighter note, I must admit I found this picture pretty interesting when I saw it, and it's nice to see the other entrepreneurs here smiling as well. because what you see here is even though the flowers are welcoming, it's not easy to find an open door. I don't see it, but let me know if you see it. No, but seriously, I know I worked at Sahlgrenska for 6 years, and I know that there is a lot of interest amongst the employees, doctors, nurses, to employ innovation that is proven to improve patient outcomes. And this is just based on our experience. Our experience indicates that the system, this complex system, is somehow more constrained when it comes to adopting innovation if it's affiliated with a startup. But the good news is that there are a lot of people here working hard in finding doors like this. And that brings me to our key word. Courage was mentioned. That's one of our key words, but resilience is an ingredient that every startup has to have. And my last take-home message is there is always more than one way to reach a goal. In our case, the goal is quite simple. We want to prevent strokes and heart attacks on a large scale using smartphone technology. And with resilience, you can find ways. So even if many governmental processes, governmental healthcare processes are not there yet, you can still reach your goals. And in fact, most of our revenue in Europe comes from employers and insurers, where the situation is pretty much the same. So 1 in 3 typically have prediabetes. Many of them are unaware, unfortunately. So what we have created is we launch worksite wellness challenges where we have gamified the process of getting screened for these conditions, and we screen for other conditions as well. And that's how we identify people at risk, and then we take care of them in a lifestyle change program and reverse the risk. And now coming to an end, I always find it's more interesting to look at real-life cases instead of slides. So this is an example from working with a large employer. We engaged 2,200 employees in a health workplace wellness challenge, and the activity was quite nice. We recently did this, and they did 500,000 health improving activities. But most importantly, we identified 220 pre-diabetic taking time bombs at risk of heart attack and stroke, and we were able to channel them into our program where they can reverse the risk. So we have been rolling this out in the last months, and this is my last slide. So this is our story so far. It only has 3 chapters. We are still writing the 4th, and who knows, I might get the opportunity to share how the story goes later on. This is kind of the working title of the story. With SidekickHealth, we want to do good by doing well, and so that's kind of our company motto. Thank you so much.